And Ryan, I'd like you to pick the next nutraceutical. What's your next favorite?
Oh, how can I not go with Calm Mind, Dr. Bill? I mean, Calm Mind just
that comes up all the time.
It's a big seller in my household, and it would be a big seller in virtually anybody's household that ever tries the product, because so many of us are dealing, obviously, there could be elevated cortisol, but just anxiety, feeling a bit overwhelmed and or craving things. I'll tell you, that's a big one, right? Maybe it hits you in the evenings or something like that, where you're like, it's maybe alcohol, or maybe it's later at night and you get ice cream or something like that. You can shut that down. And it's pretty remarkable, because it's all about dealing with a deficiency with myo-inositol, a bit of taurine, a little bit of GABA and theanine, and then also some mag-glycinate. And that powdered formulation, usually within 1 to 2 scoops for most people, will make a just dramatic difference to them in about 20 minutes' time. And all of a sudden they'll say, I almost always have to have this, and now I don't even feel like I don't even know why I want it. And it's so interesting, and that's because your body is going for balance. The neurotransmitters may be signaling, but whether or not you have the right raw materials in order for that to make an intracellular communication and make it properly, communicate the way you need to, a lot depends on what you see in RelaxMax, or the Calm Mind, and the ability to relax the body.
Exactly. Now, one of my next favorite is Cognition Plus and Brain Power, and little brother to that, Synaptin. Let's talk about Cognition Plus and Brain Power. To make people smarter in an hour, more productive but less stress. I was watching the mixed martial arts fights, and I think he took on more than he could chew. Conor McGregor, who's a mixed martial artist, and I think he was fighting 30 points below his, above his weight class. And of course, the mistake he made a mistake to try to start doing Brazilian Jiu-Jitsu with somebody who's a 10th level black belt Brazilian Jiu-Jitsu, and he's really a boxer and kickboxer as well. He's into that. Well, the fact is, what people should understand, if you want to protect your brain from being banged around in a martial art, if you want to protect your brain from stress, where it's causing you to disturb your sleep or not to remember things or actually lay down, remember, learning is a 3-phase system. First is what's called a virtual network of firing nerves. Second is what's called facilitated pathway. And the third is microtubules that record your memory in your brain. And Cognition Plus, I call it the Smarter in an Hour pill. I could actually try to steal the name and call it Limitless, like the movie, like the miniseries now. But it really contains huperzine, which is in that movie. They call it NZT. And it has a number of other things. So Cognition Plus and Brain Power, these are some of my favorites.
Yeah. Well, why wouldn't they be, right? You get your brain firing, and it's a lot more fun to live than this life where you're saying, hey, look, I can remember things. I can read and understand and comprehend and retain things. Right. And that makes it a lot better. So Cognition Plus is a multifaceted approach to kind of deal with different deficiencies and maybe existing and causing disruption in the way the brain works. And so Cognition Plus really is a nice, well-rounded formulation that a lot of people are going to find very, very beneficial. But I would start a lot of people, Dr. Bill, right in that Brain Mag area. Brain Mag is such a neat formulation because you're addressing the issue of a fundamental deficiency, which is magnesium in the brain. And we can all generally relate, if you've ever been around Dr. Bill or functional medicine, the need for obviously magnesium in the body is high. But what we always would think about is that when we take magnesium supplements, surely that magnesium is getting adequately to the brain as well. And that turns out not to be the case. And so by the special form of magnesium that's in Brain Mag, it is a special form of an amino acid that allows it to be basically sucked across the blood-brain barrier and elevate those amounts to a point where you're really seeing in human clinical studies, major improvements in 12 weeks in cognition difficulties, people that are starting to lose their memory, which is just fascinating because that's not something you see. And if a pharmaceutical drug could do what this has been shown to do, it would be the greatest thing since sliced bread. And so that's an important one to keep in mind. But also, at the same time, it's been used in animal studies, and those animal studies were dealing with not just cognitive difficulties, but things like fear extinction. This is very real. How many people truly have what's known as PTSD? They're not necessarily military people. They've just done something in their lives or been exposed to something in their lives that's very traumatic. And so being able to, sort of rewrite the hard drive, if you will, with messages that are original spiritual messages is important. And a lot of people would love to do that. That's one of the benefits of being shown to do. And then beyond that, it's also been shown to protect the brain. Even in animals that have an Alzheimer's gene, it showed those animals actually never actually getting Alzheimer's. And they actually live longer than the animals without the Alzheimer's gene. So even though genetics may load the gun for a lot of people to say, hey, I have a propensity in my family for Alzheimer's, something like brain mag may be a protection mechanism that's dramatically needed.
Yeah, in fact, I have to say that if you take brain mag, and then my other favorite for brain protection is Omega Supreme Krill and the ellagic acid. But if you take brain mag and Omega Supreme Krill, you can't have a stroke. And take along with nattokinase to prevent what we call blood viscosity microclots. The amazing thing is magnesium, and I get Chauncey Crandall's heart newsletter, and of course I already knew a lot of this stuff, but it's nice to have somebody else write it who's actually a Christian a Christian functional medicine doctor who's really advanced. This guy's good, but he deals with conventional things, and he says the best test to find, I agree with this, the best test to actually determine if you have, nascent heart disease where you're gonna blow an artery in your brain or your heart is to do what's called a high-speed CT scan with a calcium score. Now, I've been promoting this for years, or a CT angiography, we call it. And it only takes 8 seconds. It's like, bam, you're done. It's like, well, you mean that's all I have to do? No, you don't have to do anything. You don't have to run on a treadmill. In fact, if you actually compare it to treadmills, treadmill will miss 2 out of 8 people that have heart disease and are ready to go what we call face plant, to die. 2 out of 10. You don't miss any on a high-speed CT scan calcium score. Now, do you want to reverse that? The very first thing you do is you can use magnesium glycinate malate. We have our magnesium taurate too, which is helpful, but the most important is magnesium glycinate malate. And brain mag, because you're not just calming down the heart, you're calming down the central nervous system, which is why we use other things like Calm Mind and Brain Mag and Posinol to calm down the CNS. Because the sympathetic overdrive is a major factor. You cannot have a heart attack or a stroke if you have adequate magnesium level in your tissues. You just can't. People say, well, why? Because magnesium actually boosts your glutathione peroxidase activity, it prevents free radicals, and it buffers the heart against damage. So the very first thing, for example, I actually was one of the instrumental doctors to bring magnesium to the ACLS protocol back in 1978. I was a resident at Calgary General Hospital, and I got tired of working in emergency and seeing people die on me. And I said, I went back to the library, and I'm kind of a little insomniac, so I'm reading and researching at like 2 in the morning. It's like, they did these dog heart studies at the University of Texas and A&M, and they ligated the arteries and found out that there was magnesium depletion in the heart muscle. I said, good. So I asked the pharmacist for a whole flat of magnesium sulfate, because that's what they had, and they had some other forms of magnesium. And I would stick it directly into cardiac needles, directly through the chest or through the subclavian or central venous line. I actually do the line, boom, right there while the person's having a heart attack, or direct intracardiac, right through their chest wall, right into their heart. And I got people back. People with hypothermia, torsade de pointe, other forms of cardiac arrhythmias, and say, how'd you do that, Diggle? I said, magnesium. But if you maintain high levels of magnesium, by the way, do you know how easy it is to get your magnesium up? Not too damn easy. If you start on taking an adequate, good dosage, which, by the way, our magnesium won't give you explosive diarrhea, like other forms of magnesium, like whatever, like magnesium oxide and stuff. Boom. It could take you 2 or 3 months, up to 6 months to get your magnesium up. But if you get it up there and you maintain it, you can't have a seizure, you can't have a stroke, and you can't have a heart attack. And if you do calcium score of your arteries, you say, whoa, calcium score is getting better. Doc, this is not possible. Take full vitamin K2 to reverse the score. Take Omega Supreme Krill, Cardiovasc, and take lots of magnesium. Magnesium Brain Mag and magnesium glycinate malate, taurate. Guess what? You take the mag, don't die. Amazing. Oh, it's nice to, I call myself a medical carpenter. Measure twice, cut once. You have to have a way of assessing whether what you did actually worked. Whether you're improving brain function, decalcifying arteries, preventing plaque formation, improving behavior, improving memory. turning off autoimmune disease and cancer. So one of the other things that I saw is this drug called Celebrex. These drugs drive me nuts. I can't tell you how many side effects I've seen over the decades from arthritic drugs and disease-modifying drugs, for psoriasis or MS, Copaxone, or especially arthritis. And we have things now that are natural: Tendon Mender, Joint Performance, Collagen Max, Mountain Red Velvet. These are, we call disease-modifying nutraceuticals that work at the underlying cause of the problem. They don't cover it up, just like we have GastroHeal to cover up your stomach, not the idiot drugs, Prilosec and Nexium. These drugs are what I call criminal drugs by a criminal big pharma cabal. And to me, I'm telling you right now, this year, 2016, big pharma's dead. If you had a major plague of a bacteria, even virus like the Zika virus, do you think that these big pharma people have anything to actually counteract this, or a methicillin Staph aureus or anything else? Of course not. Of course not. And then when they give you a drug like Celebrex, they actually dry out your joints, or ibuprofen, so they accelerate the breakdown and fracturing of your glycosaminoglycans of your cartilage, so you get a dry joint, and eventually you're going to need a joint replacement. Not so with Tendon Mender, Joint Performance, Collagen Max, Mountain Red Velvet. So, Ryan, let's talk about this for a minute, because I think people should start to grasp that we have real solutions that over time, and if you have inflammation, use Inflamex. Topically put around the joint, pregnenolone and curcumin cream, rub it in, and start to fix the problem. If you have microcirculation in your eye, take things like forskolin, vein away, and ellagic acid to improve the circulation in the eye and the microcirculation with Cardiovasc, and stop the free radicals in the back of the eye with Nutritrella, Cell Detox, Glutathione, and Regenerex. Vein away, especially for the kidneys. We have people who reverse their kidney damage with ultrathymine B1 and vein away. So, let's talk about this for a minute. People should start to grasp that the age of what they call the commando big pharma drugs is over. It's over. Now, there's going to be some to hang on, and there'll be some drugs that will still have some use in certain situations. For example, glucophage, which is around over 60 years, it's actually a pretty good diabetic drug. But you have natural things like diabetoline, Biotin Plus, chromium cruciferate, glycemics that'll lower your glucagon and insulin output, and you don't need to worry about side effects. So, with joints, Tendon Mender, Joint Performance, and Collagen Max, I tell people they start this, and it's going to come on gradual. It's not going to bam, but if you want to turn off the inflammation, use Inflamex and the topical pregnenolone anti-inflammatory cream and curcumin. You'll get pretty fast relief, especially if you want to use like a molecular pulse or a lumen photon machine. But you're actually going to fix the problem. You're not going to have a dry joint. You're not going to have a joint where you make it numb so you don't feel that you're tearing it all to pieces. Doctors need to realize that. And they did a study a few years ago and found that 79% of NBA basketball players and NFL players, on average, have a major tear of their rotator cuff of their shoulder. We're only looking at the shoulder joint, not even the knee. 79% that if they had an MRI arthrogram, they should have at least a partial repair to a complete repair of that torn part of their shoulder. And, of course, they're taking all kinds of stuff to numb them up, including narcotics and God knows what else. They're probably taking illegal drugs, too. And eventually, if the thing ruptures, and you're out in the court shooting one of those long shots across the court to your point man, and it goes pop, your career's over, for a while anyway. So, Ryan, carpal tunnel. People aren't constantly at the keyboard. Tendon Mender, Joint Performance, Collagen Max, Inflamex.
Yeah.
As I say, these are like the magic keys for courting wellness. If you take this stuff, you're not going to have side effects. You're not going to end up with a gastric hemorrhage and bloody stool. I remember back when I was in medical school, before we had understood Helicobacter pylori caused it and so on, we see people in the emergency department bleeding out from an ulcer. I mean, they're going into full-fledged shock. I mean, we were basically having to scrub up, get down their stomach and try to cauterize it, or actually open them up and actually stop the bleeding, or they're going to bleed out. And a lot of these drugs that they take, like Prilosec and proton pump inhibitors and hydrogen H2 blockers, they don't fix the problem. They don't fix the dysbiosis. They just kind of just mess around with it. So let's talk about tendon mender, joint performance, and collagen max for a minute, and Inflamex. So you do not want to take any of these what we call anti-inflammatory or disease-modifying drugs if you have arthritis or polymyalgia rheumatica, rheumatoid arthritis, scleroderma, sarcoidosis, whatever. You do not want to take disease-modifying drugs or steroids.
Certainly not. Everybody, is told that, once you do these, a medication, it's not going to have any detrimental side effects. It'll just solve your problem.
Yeah, right.
I think we've all come to the conclusion, in our own personal lives, or we've had family members who are like, that's not the case at all. And for everything that you do to blunt inflammation or to tone something down in a lot of ways, you're making a trade-off. So that's what's so neat about, the things that you offer through the Nutrimedical line, Dr. Bill, is the trade-off is usually one, it may take a little bit longer, maybe to control things, but usually not much. But the benefit, the payoff is that you're really fixing the underlying issues that are going on and allowing the body to restore itself like people want without doing further damage or damage in other areas. And so a product like Tendon Mender, there's not much people can do other than take anti-inflammatories for repetitive motion injuries. They can go to rehab or they can ice or wear a brace or whatever, but most people are literally plagued for months or even years on end where they can't get it fixed. Now, what's neat about Tendon Mender is it sends in a unique message to the tenocytes, and it allows them to lay back down or to thin out, and improving the range of motion, and also curtailing a lot of the inflammatory messages that are coming out from that area. And it's pretty remarkable. I know you've seen a whole lot, Dr. Bill, how many people respond in just a matter of weeks of going, wait, what? I couldn't get this thing to fix no matter how much rehab and how much isolation I've done, and yet this material kind of reprograms it. And so that's been a very big one for a lot of people to find success that have issues with the wrists and the elbows, shoulders, knees, plantar fasciitis, Achilles tendinopathies. So it's really an important formulation to have. And it's inexpensive for people to really use compared to what these alternatives are that a lot of people are getting involved in.
Right. And we see it with a lot of what I call the base insurance carriers, like Kaiser, I call it. It's actually a very appropriate name, Kaiser, which means the Caesar or the dictator. Same with a lot of conventional medicine, including, by the way, socialized medicine in Britain, Canada, Australia, New Zealand, and a little bit better in Australia and New Zealand because they'll allow some nutraceuticals that they have to go through some pretty insane rigor to be able to be approved by doctors, but they can give some. But by and large, most doctors not only not know how to apply these nutraceuticals, which they're starting to learn because they realize they want to still have a practice. They don't want to hurt their patients if they have any empathy and some concern.
Biochemistry?
Ryan, it's interesting. I had an interesting discussion with another broadcaster earlier today before the show today, and I said, media is not the tail of the dog, it's the brain of the dog. In other words, media or consciousness, which is now internet, radio, television, YouTube, live stream, whatever, is the central thing that actually governs the whole trajectory of a whole civilization. And now we have this, what I call mega brain, where it's connecting human beings and providing new information that can be validated. And people are getting very discerning. They're real. That's why people like like Trump and Bernie Sanders, because they're against the establishment. They actually provide things that make sense. Even though Bernie has a lot of heart, he doesn't have much brains in order to be able to carry it out. Trump, I think, has the heart and brains to actually do stuff. In fact, I'd like to see, although I don't think it'll ever happen, where Trump makes his vice president Bernie Sanders. I think it would be funny. What will the establishment do then? Because, as I say, there really is only one party in politics called the establishment party, and there's of the snake, I call it. There's a Democratic wing and there's a Republican wing of the snake party. And Bernie and Trump are outside of that, which is why they're getting popular. Well, the same thing with your nutraceuticals. I got an email just while literally we're on break. And the email is a single mom with data entry, customer service, and she dresses hair. And, of course, she wants to get over carpal tunnel syndrome and tendinitis. Collagen Max, Tendon Mender, Mountain Red Velvet, and Inflamex. topically put pregnenolone cream on her wrists and curcumin. And if she can afford it, get a lumen photon machine and put it on the setting number 7 for inflammation and for healing, the NICO setting, connective tissue setting. And guess what? She'll heal. She'll not need surgery. She won't need a carpal tunnel release surgery. She won't need dynamic braces and all this other crap. She'll actually fix the problem herself. She might need some deep tissue massage to break up scar tissue once she's on the anti-inflammatories, once she's on Inflamex for a few weeks. If she gets an occupational hand therapist to do nerve glide exercises and to do deep tissue massage and break up the tissues, because it's going to hurt for a while, but that's because it's breaking up scar tissue in there. Guess what? Her fingers won't go numb, her muscles won't atrophy, and she won't not be able to feel the keys when she's keyboarding in as a data entry clerk. Now, that's going to bust up some business. Just like my cardiology buddy, Dr. Roger Damley, said back in 97 at the Swedish hospital after he asked me to explain my thesis as to what causes plaque. And his pupils got real small and his face got pale as a ghost. He said, "You're going to ruin our business, aren't you?" He looked at me like, I, of course, being sarcastic, SOB, I said, "I'll bet you do your cardiac casts on the Thursday and you do 12 to 14, and I'll bet you go golfing on Wednesday afternoon." He said, "You're batting 1,000, Eagle." And I said, "You know what?" I said, "My dad died at ideal weight with a heart attack because he was exposed to a lot of toxins. His parents lived in their late 80s. At 67, he had a heart surgery to repair a hole from one side of his heart to the other. He died 3 days later, and he was a fighter. I mean, he was trained also as a welterweight boxer, too, besides all of his other skill sets. And he was a tough character. He died because he was exposed to toxins, and his dumb doctors said, "Well, we'll just give you blood pressure pills." Of course, we're making him feel like crap, so we couldn't take them all. Well, this lady with carpal tunnel, you do not want her to have her slashed, her wrists open, or be told that she's going to eventually be an invalid. Maybe she's in her 20s, probably early 30s. Maybe she's got a family. Maybe this is her ability to get herself out of, her apartment and buy a home because she's actually got more than one job. She's working as a data entry clerk and dressing hair. Well, guess what? Carpal tunnel syndrome can sideline your life. You do not need to submit to these dumb doctors that don't know what to do. I do. Now, people say, "That's arrogant, Dr. Deagle." No, it isn't. It's called competency. Competency replaces arrogance. And when I'm lost, you know what I do? I pray. I ask God, "Dear God, I am lost." God says, "I know. I know, Deagle. You're really lost, don't you?" He tells me where to go on searching the databases, where to go and contact colleagues around the world, and how to put together a solution. I get it in prayer when I'm lost. Believe me, I'm lost 90% of the time when I first deal with a really tough case. But once you deal with enough cases, thousands of them, it's like, just like playing ping pong. So let's talk about this again. Carpal tunnel syndrome. Any special twists you found on it, Ryan?
Well, like I said, the tendon mender formulation is going to be profound for a lot of individuals. And I think that if there's other areas of the body where you're like, well, I'm sort of falling apart in other areas too, you want to really consider adding in like shakes, something like the Life Support, which has a lot of 1,100 milligrams of herbs that are really good for anti-inflammatory, but also working on the complete body sort of a reset, if you will, as a detoxification program using a modified elimination diet where you can remove these foods that can be, inflammatory in nature, and that can really help because a lot of times when carpal tunnel shows up or some other kind of chronic inflammatory condition shows up, there's oftentimes that, if a person was really pressed about it, they'll realize or they'll recognize and admit the fact that they're certainly suffering from a lot of other challenges. It happens to be that, say, carpal tunnel is the most obvious. But I think there's a theme there that people can really, embrace, which is, if the body's starting to break down in one area, it's probably not going to be much longer before it starts breaking down in another area. And so now's the time to really work on that, control. Inflamex formulation, we talked about it earlier, those enteric-coated enzymes, those are a wonderful formulation to also use for these kind of conditions.
Yeah, exactly. Now, the interesting thing is if you want to actually test it, you can actually test what's called a Axon 2 scan. I helped develop the technology with Dr. Jim Hedgecock, who got FDA approval for his research. He was doing work at the University of California, Irvine in the 90s, got FDA approval by 1997. And I added surface electromyographic research because I was working with Dr. Stu Donaldson for 7 years in Calgary between 1980 and 87 on surface EMG research. And I discovered what's called a pain circuit. And no one else on earth has published this. I know I've checked the literature over and over again for the last 3 decades. I will publish it in my book on pain, which I'm going to put out, which explains what pain is. And doctors do not understand the 7 pain gates. The primary gate is called the Langerhans gate in the skin. I discovered it, published in 1986 in my patent and U.S. patents on the Dynatens machine. And what people need to understand is that circuit also causes vasoconstriction of blood vessels, release of low, slow reactive substance anaphylaxis, bradykinin, neurotenins, and inflammatory cytokines, and damages tissues, and eventually can cinch down over blood vessels and nerves and cause neuropathy and loss of the vasa nervorum around nerves, so the nerve starts to die. Now, you don't need to have that happen. When you take our nutraceuticals and you actually do an axon 2 scan, you can see the A delta and C fibers come back. You can actually put in a small stimulus that's not painful and see an EMG response and map out whether or not the A delta and C fibers are returning to normal. You can quantitatively measure it. This is the only and the first only objective test for pain and mapping down spinal nerve roots or peripheral nerve roots of the A delta and C fibers, which are your pain fibers, in history. And I developed it with Dr. Jim Hedgecock. So, if you don't believe it, you can contact me. I can give you the technology. There's doctors we've trained as long ago as in 2003 in San Francisco, 13 years ago. We trained a lot of doctors across the country, chiropractors, physiatrists, neurosurgeons, etc., how to use an axon 2 scanner. This is straightforward. It's more accurate than an EMG nerve conduction study, an MRI, a PET scan, or anything. This is the most accurate test in the world, and it's not invasive. There's no pain or invasive big needle stuck in you or anything like that. It's all surface contact with micro gold electrodes with a little cotton swab with some electrolytes in it. That's it. So, Ryan, when someone's got carpal tunnel syndrome, we can prove it. We don't just say, oh, well, we'll make you better, and we pat you on the back and smile. No, we can give you a test if you want. If you're really curious, you don't have to. Just take our nutraceuticals. And in a few weeks, you say, I wake up in the morning, my hands are alive, they're not dead. A lot of people wake up in the morning and say, I can't feel my hands, and they're banging them on a counter because I got a key and a whole bunch of stuff today in my fingers, I can't feel them. That's because their dumb doctors have no idea what pain, inflammation, autoimmune disease, and tissue hypoxia are doing to them, and their treatment, including surgery, is wrong-headed. Okay? And welcome back to the Nutrimedical Report, and we hope to track down Professor McCanney. Hopefully we won't have much noise in the background, otherwise we'll continue on reviewing the news, post the next Super Tuesday, which is next week, which is going to deal with Ohio and Florida. Obviously, what I'd like to see is an amalgam of ideas from both, left and right side. I think that the dialectic of opposing sides is silly, and I like the idea that Trump does of quote, working on a deal and negotiating toward a solution to issues, whether it's immigration or healthcare and so on. His 7-point plan makes sense, and I'd like to see some of the things that I'm going to send in my paper, which I'm writing on healthcare solutions, which will extend beyond the idea of just cutting costs and opening lines across states, but eventually allow you to have a healthcare that's considerably less expensive and eventually gets rid of insurance. So you don't need insurance, you don't need state licensing authorities, you don't have malpractice, you have proper retraining, and you also can train laterally. So you can start off as a massage therapist and eventually become a neurosurgeon if you get the proper training at the proper centers. So what I see also is I want somebody, if they're retired and they're 70 in Alaska, why do they have to recertify if they've been in surgery for 30 or 40, 50 years in Florida? If they want to scrub up 3 mornings a week and assist in major surgery or help out other doctors and go on a rotating call schedule, it's ridiculous. They're one of the professors. They've been in this business for a long time. It's like myself. I have been out of practice actually actively seeing patients face-to-face for several years, but it's in your bone marrow when you've been a doctor. I mean, I can go back and take a trauma course in 3 or 4 days and be ultra putting in chest tubes and sewing people up and doing things in about less than a week. But you have to recertify and you have to show that you have the skill sets and the knowledge base, etc. Well, that's pretty easy to do. If you're actually still physically and mentally competent, that's not a problem. So we want to talk solutions here, and we want to talk affordability. We want to talk how we can fix things. So, I think what I want to talk about next, because we're going to hopefully track down Professor McCanney, is a couple of other things in our list of 1, 2, 3s, which are our top nutraceutical things that we often will, the top 3 plus nutraceuticals. And let's open with some of these. Now, we had a few we talked about the other day, and I'm going to move down here. Anosmia, this is an interesting syndrome where you lose your ability to smell. And if you have anosmia, you want to start repairing what's called the nerve fibers in the nose. We brought back Meniarin, which is we're going to call ear care, which is easier to spell. BioLVR, which is activated B6, B12, and folic acid. You can also add some methyl, superfolate, and pyromethyl B12 because myelination of the peripheral nerves. You need Neurogen, which is DHA, to myelinate the nerve fibers in the olfactory bulb. Cognition Plus and Brain Power, which is vinpocetine. And to kill off the sinus infections that are often a chronic low-grade inflammatory mycobacterial, fungal, and stealth viral infection. Sinupulse Elite with the Sinuair powder and Nutriodine. Pretty simple, and collagen, and Allison Med. Anti-aging. People say, well, what do I do for anti-aging? I said, well, I'll give you the top couple. There's a whole bunch you can take, but you want to take Collagen Max, Mountain Red Velvet, microdose human growth hormone, homeopathic releaser, and oncomycin or Myco D2. Those are the top starting ones for nutraceuticals. Anxiety, Calm Mind, and Brain Mag, usually 1 to 2 scoops in filtered water 3 or 4 times a day. Posinol, which is a very powerful adaptogen. It doesn't have some of the side effects of kava and others. It's really good. You can take 1 or 2 soft gels 3 times a day. And BioLVR for assisting the nutraceuticals conversion, and Minerals Plus, which contains molybdenum and other nutraceuticals you need to convert brain amino acids to neurotransmitters. If you have arthritis, doesn't matter what kind of arthritis, it could be scleroderma, polymyalgia rheumatica, you want Inflamex, joint performance, tendon mender, and of course methyl to heal the joints, and Inflamex is really important. Asperger's autism. And again, this is very common. Cognition Plus and Brain Power. And for restoring the acetylcholine levels, which are abnormal, you want to take CDP choline, ultrathymine B1, and uridine monophosphate, and it'll restore those levels of neurotransmitters. In many cases, actually, if you do a advanced testing, like Dr. William Shaw's lab in Great Plains Laboratory, you'll find abnormal organic acids. And those organic acids are caused by dysbiosis. You want to take berberstatin, Living Probiotic Ultra, and the bouncer we mentioned earlier, colon cleanse, the Saccharomyces boulardii. Once you've validated that you fixed the dysbiotic bowel, the organic acids that are forming false neurotransmitters that are dopaminergic go away, and the person's Asperger's syndrome becomes more treatable. Asthma, inhalation, right off the bat. Don't use a rescue inhaler. There's now some pretty good proof that if you use a beta agonist, you're actually increasing the risk of fibrotic lung changes. So over 5 or 10 or 20 years, if you're using a Ventolin or a long-acting Advair, you're increasing dramatically the risk of a cardiac arrest, number one. Number two, you're going to cause inflammatory fibrotic changes to your lung tissue and get restrictive lung disease we call pink puffer syndrome. Not good. It's chronic lung disease, a fibrotic lung change. Silver 100 spray will fix this. You're killing off the rhinovirus subclass 3, mycobacteria, and other fungi in the basket cells of your bronchi and respiratory bronchioles. You take 3 sets of inhalation sprays, puff, 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 hold for a count of 10, deep breath. Repeat it for a dose of 1 spray per 10 pounds body weight. If it's a really bad infection like this current flu, you might take 2 sprays, or Nutriodine, 15 drops from water 3 times a day. You can also use an Omron or a Sinupulse Elite or another inhalation machine like My Pure Mist, which you can find at Amazon. And by the way, we're going to put up a little Amazon link for a couple of pieces of equipment I recommend that we don't carry that are useful to get there at a reasonable price, like a My Pure Mist. Cell detox glutathione, extremely important, and you can also open up a capsule, grind it with a little mortar and pestle, and put it in an inhalation machine, and take it orally too. Peroxynitrate and hydroperoxy radical are the primary inflammatory molecule in the lung. Whether it's COPD or some other chronic lung condition, inflammatory or chronic obstructive pulmonary disease. Autoimmunity, we talked about this before. Malignarest, Power C Plus, and Nutrimune. Those are the first three, and of course you can add ellagic acid, full vitamin K2, Power C Plus, goes together, and Malignablock, because a ketogenic alkaline diet combined with Malignarest is extremely important for turning off autoimmunity. It means you don't feed sugar. Sugar feeds cancer and autoimmunity. That's why a ketogenic diet is very important. Lou Gehrig's disease, NutriDefense. It actually blocks the fenton pathway, helps as the nitroperoxy radical, Narival to increase dopamine levels in the motor neurons, CDP choline, and of course the use of cell detox glutathione to stop the peroxynitrate hydroperoxy radical. They're causing that secondary motor neuron in the anterior horn cell in the spinal cord to be destroyed. That's called a tertiary motor neuron. Anxiety, Calm Mind, Brain Mag, Posinol, amazing. Posinol, little brown soft gels. 2 of them 3 times a day, and you'll be cool as a cucumber along with the Brain Mag, Calm Mind. BioLVR to restore neurotransmitter levels, and of course for sleep, melatonin time release. Back pain. Firstly, physically, Inflamex, 4 to 5 capsules 2 to 3 times a day, topical curcumin and pregnenolone, tendon bender, joint performance, Mountain Red Velvet, and Collagen Max, and you're going to heal. You're actually going to heal. So I had a gentleman the other day, he was a friend of mine, he had a very bad rear-end car accident. They said his discs were kind of deteriorated. He's doing heavy labor most of his life. He actually manages our property with his crews. Really good guy, Hispanic gentleman. And if he takes this protocol, he's going to heal his joints. He won't kind of, we call squeeze out like toothpaste. Very inflammatory disc material that will cause a inflammation of the dural nerve sleeve of his nerves. Bad breath, believe it or not. Brush your teeth with Silver 100. Use a hydro floss with Nutridyne. Alice and Med. 1 capsule 3 times a day. And as soon as you kill off the nanobacteria, clear out the periodontal disease with brush your teeth with Silver 100. And by the way, our silver is the only one that's in the ionic state. Every other form of silver has only a tiny percentage in the ionic state. Silver 100 is the one to get. Balding hair, Recidival Hair Tonic, Collagen Max, Mountain Red Velvet. Bell's Palsy, Cognition Plus, Cell Defense, and Neurogen to remyelinate the nerve fibers to your facial nerve. So we have protocols for everything. These are the top ones, but we have a very complete protocol and specific tests we can give you to check with your doctors to do tests to prove that what you're doing actually works. Back in a moment with hour number 3. Stay tuned.